स्टार्ट करना है।
Wait, starting.
स्टार्ट करना है।
Wait, starting. Good afternoon, everyone, and a very warm welcome to today's webinar hosted by Onus Robotic Hospitals, Hyderabad. We are delighted to have you all join us for an insightful session on distal radius fractures, modern fixation techniques, and robotic precision. Distal radius fractures are among the most common orthopedic injuries, and with advances in technology, treatment approaches have evolved significantly. Today's session will shed light on how robotic-assisted precision is transforming outcomes, offering greater accuracy, faster recovery, and improved patient satisfaction. We are honored to have with us Dr. Rajshekhar Pappu, robotic orthopedic surgeon at Onus Robotic Hospitals, Hyderabad, a specialist known for his expertise in advanced joint replacements and trauma surgeries using cutting-edge robotic systems. Dr. Rajshekhar will take us through the current concepts in managing distal radius fractures, discuss the role of robotic techniques, and share real-world insights from his clinical experience. Before we begin, a few quick notes. Please ensure that you are muted during the presentation. You can also post your questions in the chat box at any time, and we'll take them during the Q&A session at the end. Once again, thank you for joining us. So let's now welcome Dr. Rajshekhar Pappu to begin the session. Please take it forward, Doctor.
Hello, good afternoon. Thank you, Ajay Garu, for the opportunity. So today's topic is there will be 2-3 talks on these distal radius fractures. Today's talk is more about understanding distal radius fractures and the simple fracture, which commonly happens in everybody, that is called Colles fracture. How to manage it, how to treat it, what are the indications for surgery in such fractures, we are going to discuss. Next topic will be more detailed about treatment methodologies for complex distal radius fractures. Distal radius fracture is one of the most common fracture where everybody will face it. At least every 4th, 5th fracture will be a distal radius fracture, because it happens. One is because of fragility. Second thing is the mechanism of fall. Mainly we all fall on outstretched hand when we fall, so the load comes on the distal radius, injuring your distal radius, so leading to a fracture. So why it is distal radius? First of all, because distal radius means every body in human body, everything is topographied. What is topography? In colloquial terms, topography is GPS, location. So for a GPS, for a GPS, it takes coordinates and it localizes where the part is or where one point is. Same way, for me, for anybody to understand what type of fracture I am talking about. Suppose if I want to convey somebody on phone that what fracture, I'll say distal radius fracture. So the other end, medical person will understand where the fracture is, what type of fracture, he will have an idea. At least if I don't convey him, he thinks that at least it's a Colles fracture or it's a simple fracture. After seeing X-ray, they will know how complex it is. Without seeing, at least they will have an understanding what is the location of the fracture. So if you take forearm or humerus arm, every body part, every bone is divided into 3 parts, that is proximal, middle third, and distal third. So whatever happens at the distal third is called distal fractures. Whatever happens at the proximal third is called proximal pathologies, like proximal radial head fracture or ulnar fracture or proximal third radial shaft fractures. Whatever happens in the middle zone, it is called as middle third fracture. So when we convey to somebody, I say that when we convey to somebody, we tell three things. One is fracture, bone, then location. And there is some coding words where we say it's a complexity. So if I say A, it is simple fracture, B is moderately complex, C is highly complex fracture. So how a distal radius looks? See, there are distal radius joint is formed by two bones, that is distal part of ulna and distal part of the radius. So this bone is divided into three columns actually. One is radial column, which is on the lateral side. This side it is called radial column. The middle part of the bone, which is there, it is called intermediate column, and ulna is called ulnar column. So when you see an X-ray, you understand the fracture pattern, biomechanics, and how complex it is when you treat it. Because these columns are very important for us to maintain, to treatment, how to treat it, what to treat it. Is it simple or complex? So because if looking at the columns, how many columns are involved in the fracture? Sometimes it might involve only the radial column, maybe radial styloid fracture. Sometimes it might involve intermediate column. Sometimes it might involve the ulna also. So that is more complex fracture. So both the bones are broken. Though it is distal radius fracture, I say it is distal radius fracture, but when it comes to the complexity, even ulna, the second bone also might have broken. So how do you examine ulna or radius? So you just hold the hand in your another left hand, and then just with your right hand you palpate the location of the bone and see whether there is any swelling or any abnormal movements at that crepitus. Sometimes you can feel through the skin broken bone pieces also you can feel. So you say that they will have crepitus. When two bone pieces, when you try to move the arm, you'll have crepitus, like the tuck tuck sound you will hear sometimes. So that is crepitus. And sometimes pathological movement. So that is pathological movement. Pathological movement is a movement which is normally not present in that joint. Okay. So if I'm making a deviation like this, and if it is not moving at this part, and if it is moving at this part, that is called pathological. So it is happening at a place where it is should not be there. That movement should not happen at that place. It should happen at the joint, but it is happening in a bone, so that is called pathological movement. How do you injure actually? So usually injure in an outstretched hand directly landing on your wrist. Your wrist is in extension, you just fall on it. Sometimes you might fall on flexion also, but it is very rare. Most of the times when you are falling, you outreach your hand like this. So to prevent you falling, it is protection. Because if you don't put your hand forward, you might break your face, nose, teeth, or even head. So you might land up in a head injury. This is a protective mechanism. So you are sacrificing something else to protect something else. Okay, bakra banta hai kabhi kabhi. Distal radius. It's only to protect protect you from the most severe injuries. So this fracture, which happens at 1 centimeter from the articular surface, joint line, is called a Colles fracture. So there are many patterns of distal radius fractures when you talk about this. There are many classifications. One classification is AO classification. There is another classification, that is Fernandez classification. Fernandez classification is the simplest form. It has type 1, type 2. Type 1 is just only one bone is broken. Type 2 is the other bone is also broken. So this is simple fracture. So from 1 to 5, 6, the severity increases. So you can understand, if I say Fernandez type 6 distal radius fracture, the other opposite person understands that it is very complex fracture even without an X-ray. So this is way of communication. Why we classify these fractures? Because professionally, when we convey to somebody that, when I am telling somebody that it is a type 5 Fernandez classification, type 5 Fernandez, it is type 4 Fernandez, the opposite person understands that the severity of the injury also. If I say type 1, you will understand, okay, right. So this fracture, which just now I told you that which happens from 2 centimeter from the articular surface. This is articular surface, and this fracture is happening at this place. These fractures can be green stick fractures. So this fracture, what is shown here is a green stick fracture. Why it is called green stick fracture? Because these fractures happen in children. Why it is green stick? Second thing, because for them there is a periosteal layer on the bone. That periosteal layer is the one which deposits bone. If you have broken your bone, that periosteum is the one thing which repairs the bone. So if once periosteum is lost, your bone is a dead bone because it cannot regenerate. It will not have regenerative potential. So in children, what happens when you break, when they fell down, their bones are weak in children, but the periosteum is very thick. It won't break. That's why they are called green stick fractures. It's like if you take a tooth stick, that is neem stick, what we use for cleaning teeth. When you bend it, it won't break sometimes because it is green, and it only breaks from inside. The outer thick bark doesn't break at all. So that is called green stick fracture. That is why it is green stick fracture. So this is a fracture. This is actually Colles fracture. It is a simple fracture. So when you take this X-ray, you see there is many changes here. The articular surface is dorsally tilted, and then this is. So I'm going to explain you what we look into a distal fracture first of all while treating a distal radius fracture. So when you are treating distal radius fractures, you have to know some values where on basing on what parameters we are going to judge whether that is in position or not in position or mal position. So see this line, radial inclination. So a line is drawn from the radius to the ulna and a line is drawn along the articular surface of the radius. So that is called radius inclination. So that is articular surface which is tilted. So that tilt is sometimes it is the angulation is there. It is naturally it will be between 15 to 25 degrees centigrade. Anything less than that is not acceptable. But in some instances we purposely keep it less than 15 degrees. But that is different scenario that does not come here. And also when you take a lateral view, your articular surface is tilted like this. So it won't be straight like this. So it is tilted. But in a fracture, when you see the old X-ray, see it is almost straight. If you take a dry line, it is tilted posteriorly, but actually here it should be tilted anteriorly like this. So that is volar tilt should be there. And then when you take this, where we are talking about two bones, that is ulnar column. So these two bones should be of the equal length or 1 or 2 mm less. That is called ulnar variance. So these are the three parameters. Basing on this, we assess a distal radius fracture, whether this requires surgery or does not require surgery. So when we operate also, we have to restore these angles. Otherwise, patients will develop arthritis. So this is a tilt. So if you take, when I draw a line like this, it is tilted backward. So this radius is also shortened. This ulna is longer than radius. So it should not happen, because when the ulna is longer than radius, what happens? Whenever you do a ulnar deviation of the arm, you will get, it gets impinged and you will start getting pain after 3, 4, 5 years. That is called ulnar impingement, ulnar impaction syndrome or ulnar impingement. You will not be able to lift utensils from a stove, heavy utensils, because you will be holding like this. So it will get impinged. Whenever you do this kind of movement, you will get impinged. If you have to hammer somebody something, so you are impinging here. So these all parameters are compulsorily we have to look when we are assessing an X-ray. So without assessing all these things, if I treat, it is not a justice to the patient, because of the trust he has put in me. I am not doing the right thing, because we have to restore all these angles for the person to get back to the full duties. So after the fracture is assessed, everything is done. So what we do, we in simple fractures like Colles fractures, which we are talking about. This is simple. This is the simple fracture. For this type of fractures, we put plaster. For this type of fracture, we just give a regional block, we reduce it and put a plaster. So this is the plaster. There are many varieties of plaster. First, we put padding. A plastic cover is worn, a net stockinette is worn. Over the stockinette, we put a cotton padding, compressed cotton, so that you will not get compressed, that skin doesn't get irritated because of direct contact with the plaster. Then once the padding is done, synthetic cast is applied. So this, we'll keep it in position like this, and the fracture treatment varies. This is conservative treatment. So where this, when all the angles are maintained, patient do not require surgery. He is just a simple cast is enough. Collis fracture is the most beautiful example for this kind of treatment. So here we can treat these fractures completely conservatively without surgery. So in this, the red plaster we keep, usually the duration of plaster will be from 3 to 6 weeks, but usually 3 weeks is enough. After 3 weeks, plaster is removed, and then physiotherapy is started to regain full function of the wrist. Otherwise, even if I have done the treatment, you have not recovered your function, then it is also an injustice to you, because with wrist is one thing what you use it most often. So if you have to eat, if you have to comb, if you have to lift something, the wrist is more important, and wrist has very fine movements. So if you want to play a guitar, finger movements are very important. So after we put plaster, most of the patients develop stiffness in the arm. So we have to treat that all consequences. It will take at least another 1 month for you to recover fully from the injury, and then you will be returning back to work only after almost 2.5 months. If you have a distal radius fracture, you will be able to drive your car or bike only after 2.5 months. Car you can drive early, but bike at least you have to wait 2.5 months, because bike requires you to hold it very firmly. Car you can manage after 1.5 2 months. After the plaster is removed, you can start driving the car if you have good movements. But if you don't take physiotherapy after distal radius fracture, you will not have movements, your arm will be straight. So many times what happens, people don't come to us, they go to quacks for the treatment. What a quack does is, they do what? Actually, already you had an injury. When there is an injury, you will have bleeding. So actually, you should not put, we at may hospitals, we put cold compress. But in the quacks, what they do, they put hot wax. They apply hot wax. So the hot wax will improve the increase the blood circulation. It increase blood circulation at the injury site. Another thing, what happens is they do massage. Now I think they stopped doing massage. Earlier they used to do massage. Because of that massage, what happened? Already damaged tissues. Sometimes some nerves are also involved in this injury part. So after the massage, what happens? They will damage completely. And that massage is done repeatedly over a period of time. Every fourth day they do till the fracture heals. Or he doesn't even know whether fracture has healed or not. He will do it for 1 month, 2 months, 3 months, and then let you go to your life. Then you land up in a situation where you start developing severe pain. That is one of the complications of the distal radius fracture. It might happen even without massage, but if you do a massage after distal radius fracture, you will compulsorily land up in pain in the wrist. That is called reflex sympathetic dystrophy. So what happens in reflex sympathetic dystrophy? Because of the massage and all that, your nerves get damaged, your blood sensation changes, you will have hypersensitivity. Skin is very hypersensitive. If I touch it like that, you will have a lot of pain, irritation, and all that. Then you will have increased blood supply to the hand because of this massage and all that vascularity. So that increased vascularity causes osteoporosis in the arm. So your arm is stiff, you won't be able to move it, you will not have movements. So the treatment is very difficult. Once it starts, it will never come down. You have to take blocks. Sometimes we have to do surgery to recover you. So massage is not a good thing for distal radius fractures. Many think that Jarrah will do all the work. So he is the god. But actually, it's not like that. We see many patients who come to us with these kind of complications. The other complications of distal radius fracture could be malunion. Malunion means it won't heal properly, and your arm looks not straight, bent, curved, and all that. These all we'll discuss afterwards. There will be a separate topic on this, that is malunited distal radius fractures. What we have to do, what can be done, how to get back to the work. So that is entirely a different topic, because it's a complex. Distal radius is not very simple. It's very complex. Treatment is complex. It can be simple to the very severe. So this is all about the first part of distal radius fractures. today. Thank you very much for your attention. If you have any doubts or questions, you can start asking. Thank you.
Thank you so much, Dr. Rajshekhar, for that highly informative and insightful presentation. We've received several interesting questions from our attendees. So let's move into the Q&A session now.
Yeah.
So we'll start with the first question. Doctor, what are the most common causes of distal radius fractures in adults and elderly patients?
Fall, fall. So they don't have balance. So they fall, very even simple fall causes fracture in them. In young patients, it must be a very hard fall. But for them, even if they try to sit on that arm also, they might break because it is very complex. So their bone is very weak. So because of that, they develop fractures, distal radius, and it's very common fracture in elderly. Maybe every second, third, or elderly will come to ER for this with this fracture once in their lifetime.
Okay, thank you for that answer, doctor. And another question I have is how does robotic precision improve patient recovery and functional outcomes?
You see, we do not do, as of now, we are not doing robotic, not using a robot, but there are some technologies that is precise technology, that is some drill bits have come, some screws have come. What happens? The drill bit will have sensor that you attach to some machine. So when you drill, it will give you the depth of the screw. So our job is mainly carpenter job. So we fix the fracture with plate and screws. So for the screws to fit into the body, I have to drill holes in the bone. So usually we take a measuring device, measure the depth. But here what happens? The drill bit itself gives you the depth of the hole. So I can take easily screws. So what is the advantage is that distal radius has lot of tendons. So many times complication post surgery is tendon ruptures because that screws comes out protruding from the bone. So tendon gets rubbing against the screw and that causes tendon injury. After 6 months, maybe 1 year, 2 year, they develop tendon injury and then the tendon will be ruptured. So that helps in precision putting screws and all that. Yeah.
Thank you.
Whereas we are buying one robot, Miso robot. There we can use it for fixing fractures. It will come in the month of this month and it will also help in giving guiding screw direction and all that. It can be used for fixing fractures.
Thank you, doctor. Thank you for those informative answers. Today is World Spine Day, and so do you have any preventive measures on lifestyle tips you could recommend to reduce risk of distal radius fractures or any such bone injuries from your end?
See, spine is different thing and wrist is different thing. So
I understand we are deviating from the topic, but then are there any preventive measures which you can suggest to people who are prone to such injuries?
for spine injuries,
Yeah, both distal fractures and spine injuries.
see, when there is a spine problem, there are different things. One spine don't cause distal radius fracture. One thing because today is spine day, we can advise people to maintain posture, sit erect, maintain their laptop at 100 eye to eye contact with the screen, so that they can have good spine. Their spine doesn't get degenerated. So that is the advice I want to give to the viewers who wants to maintain their spine health.
Sir,
Yeah.
are there any lifestyle tips you would like to recommend to reduce the risk of distal radius fractures other than, of course, not falling?
See, thing is that when you have old people at your house, they will be falling down. So whenever there are old people at home, what you have to do is you have to put some carpet, soft cushioning in the home. So even if they fall down, they will not have these fragility fractures of the distal radius. If they're going to washroom and bathroom and all that, you have to put anti-skid tiles in the bathroom. So we usually have smooth tiles. So it is better to have anti-skid tiles in the wash area and also washrooms where they don't skid and fall. That is one thing. Second thing is that if you put some bands, wrist bands or something, what happens? That will prevent hyperextension and that will also prevent some reduce the impact of the injury. But best thing is to have soft cushioning. Like you have to put a small 1 inch, 2 inch mattress in the on the floor, so that even if they fall, that will reduce the impact and they will not fracture their limbs.
Great. Thank you. Thank you very much for answering those questions very patiently, Doctor.
Thank you.
So that brings us to the end of today's webinar on distal radius fractures, modern fixation techniques, and robotic precision. A big thank you to Dr. Rajshekhar Papu for sharing his expertise and for giving us such a clear understanding of how robotic technology is redefining orthopedic fracture care. We also want to extend our gratitude to all the participants for joining us today and making this session interactive and meaningful. Before you leave, we request you to take a minute to fill out the post-webinar survey that will appear on your screen right after this webinar. Alternatively, you can also fill it from your email. The link would be there. Your feedback helps us improve and plan future sessions better. So stay connected with Onus Robotic Hospitals for more educational webinars and healthcare updates. Thank you once again for being part of today's session. Have a wonderful evening ahead. Good day, stay happy, and stay healthy. Thank you.